A very good evening to all. A very happy new year to everyone, and welcome to session 16 of Life and Homeopathy Through My Eyes. And the topic today is on female health. Once, when a male gynecologist was asked as to why did he select gynecology as his career, you know what he said? He said that uh, it's women are basically extraordinary. Everyone comes from a woman, and there is something to be honored about a woman. Wow. Don't you think it's time that we rethink and reshape as to what we feel and think about ourselves? Well, because today in modern times too, you will find that females find it difficult or shy to talk about their female health. And let me tell you, poor gynec health attributes to one among the major causes of poor health in females. It could be anything from pain to cancer. Yes, and it affects one's sexual life and married life too. So it's important that we know, we understand, we accept, we respect and take care of our body. Yes, because our reproductive system is also an important part of it. We need to really take care of that too. So, to guide us today with her immense knowledge of almost 4 decades, we have with us today on our session India's first laparoscopic surgeon, and that is Dr. Lili Keswani. With vast experience in her field, she has presented papers at national and international level. And not only that, she has co-authored a book in gynecology which is available on Amazon. So we are looking forward to having you soon, Swani, and within few seconds we would be having her here, and I am really awaiting your presence, Dr. Lili. A very good evening to you, Dr. Lili. How have you been?
Good evening, Dr. Acharya, and 1,000 apologies.
No problem, technical problems, glitches do happen, and that's a part of it, and we have got over it now, and so let's go ahead with it. So let me tell you, viewers, it's been a pleasure knowing Dr. Lili Keswani, and not only is she senior, but she is very young at heart. She connects so well with people of all ages, and I have seen her do that. She's absolutely energetic and dynamic in whatever she does. So really, it's a pleasure to have you with us today on our session, Dr. Lili. And let us start with the questions that we have lined up for you so that our viewers can get the best
Thank you so much
benefit
for inviting
of
me.
your presence. Yes, thank you. It's our pleasure, Dr. Lili. So if we go with the first question, let me ask, nowadays, girls are getting their first periods, what we call as menarche, very early, as early as 9 to 10 years, sometimes even 8 years. Why is that happening today?
So, menarche is a function of the body weight, Dr. Acharya, as I'm sure you already
Okay.
know. And the body weight nowadays, because of the junk food that we are exposing our children to, the junk food, not only the macronutrients are not in balance, but the micronutrients are not in balance. Plus, there are toxins such as the free radicals and the trans fats that are coming along with that. And this imbalance of nutrition plus the toxins, all of these create an environment where the hormones are disrupted and early menarche occurs.
Right, very true. So where from 16 to 17 years, it became 14 to 15, then became 12 to 13, and now it looks as if it is really gone to now 9 to 10 at
In
times
fact,
with
my own
the
doctor had a
females.
menarche before 10 because I didn't know. Even as a gynecologist, I didn't know what were the factors that could affect it.
Right. So in the first year of menarche, many a times the girls have very irregular periods. It could be coming once in 3 months, sometimes even once in 4 to 6 months, or the periods would be just spotting, scanty, or they would be long lasting, but the flow would be negligible. So is treatment needed during the first year of menarche, if their
Uh,
periods are irregular and what I have just put forth to you?
As both of us know, of course, it takes a while for the hormones to settle, and it is quite normal for the periods to be irregular during the first year. The only
Right,
condition where we need to be careful is if the bleeding is heavy. But if it is not
right.
heavy, fine, we can just wait.
Okay. So in short, we should avoid anemia happening, the hemoglobin going down, because it would lead to other problems. And so only if that happens is where we need to
Yeah.
intervene. Otherwise, we can allow the body to settle and get the hormones balanced and take it ahead. Right. Okay. So from what I learn, what I understand from you, these type of foods, the eating habits, we mothers need to inculcate very early in our children. Now here I'm saying children because here I don't demarcate, here health is for both the boys and the girls. But well, coming to girls related to menarche, it's about the body weight, as Dr. Lili just put forth, the processed food, the fats, the type of macronutrients that we introduced to them. That is the main cause that could be lead to this fact. And so we need to take care on that level, and we need to start as young as possible introducing these habits. So going ahead, Dr. Lili, nowadays even polycystic ovary syndrome, PCOS as we call it, is very common. Almost, I think, if not mistaken, it's anywhere the ratio is 1 in 4 girls or 5 girls on an average, females getting PCOS. So why is this getting so common? During our young days, we probably heard of it more theoretically than saw in practice, but now it is every fourth or fifth girl is saying that I have PCOS or I have polycystic ovaries. So why is this so common to today?
So the reasons for chronic disease remain the same. Again,
Okay,
it's junk food, processed food, refined foods,
right,
packaged foods, improper sleep habits, stress, exposure to screens, radiation,
true,
uh, improper nutrition. We don't know what is right and what is not. We think we're doing the right things, but often we don't even know what is right. And I'm talking about myself as a doctor. I didn't know, and that's because we are not taught about nutrition at all. We don't know what
correct.
to do, what not to do. So, and also we didn't understand that PCOS is a metabolic condition. It is not just a hormonal condition. As a gynecologist, I was given hormones to suppress the condition and to artificially manipulate the periods. But that did
Right.
nothing to treat the root cause. But now we know that it's a metabolic condition and we are able to treat the root cause.
Right, right. And is PCOS connected to fertility? Because you will find that the mothers, especially if the girls are young, the mothers are of great concern whether it will affect fertility in the later years, or if the woman herself who is around the marriage age, having the concern of whether she will be able to conceive or not. So what's the relation between PCOS and fertility?
Yes, as you already know, of course, Dr. Acharya, definitely PCOS is associated with infertility. What is happening
Right,
is the follicle, the ovum, the egg is growing, and then it ruptures. The follicle
right,
releases the ovum, and that ovum then gets fertilized or not by the sperm. But here, what we have is that we have the follicles all of the same size, they're not growing. If they're not growing, they cannot release the ovum. And if the ovum
right,
is not released, it cannot get fertilized. So then we have to
correct.
use artificial reproduction techniques or ovulation induction in these girls.
Correct, right. So, in short, as Dr. Lili has very nicely put forth that it is lifestyle which is at the root of it. I think that's the first line of treatment which comes into play. That is eating healthy eating habits and exercises, activity that is important to maintain a ideal body weight as much as possible, so that the hormones don't get imbalanced and PCOS doesn't happen, and naturally then fertility will not be a problem. So, well, going ahead with the next question, Dr. Lili, what are the common gynec problems that the girls face today, that females face today?
So the common things would be disturbances in their regularity of their periods. Either they could be too close or too far, or they could be too heavy or too light. These are the common things that happen. And then they want to use pills to delay periods. They have been using pills to prevent contraception. And sometimes they use it as a contraceptive method repeatedly, even twice in a cycle. I've seen girls using them. And that is absolutely the wrong thing to be doing, to take these things so lightly. The other thing could be itching, discharge, uh, urinary infection. But so long as we maintain a good level of hygiene, these are not really going to happen so much.
Okay. So, even white discharge or leukorrhea, as we call it, you just mentioned about itching and those things, which could be related to fungal infections and excess of white discharge. Though some amount of white discharge is considered to be normal during the menstrual cycle, but when is it that the girls actually need to go for treatment for the white discharge problem, or when is it a problem?
If it is profuse, if it is itchy, and if it is smelly. And of course, if there is even a slight amount of blood stained, if it is even slightly blood stained, it has to be taken very seriously.
Okay, right. So many a times now with the advent of panty liners, we find that the younger girls are using this very often. How safe is the use of panty liners?
But they're backed by plastic, and the use of plastic close to the body is never a good idea. So maybe, on say the fourth or fifth day of a period when the bleeding is very light, instead of using a sanitary pad, maybe one could use a panty liner. But to use it during cycle, that would really be a bad idea.
Okay. And even to be used during the month regularly on a regular basis also is not something that you would advise, right? Yes. So viewers, as Dr. Lili spoke about maintaining health of our parts, the system, it's important that we keep the area dry, and panty liners having a plastic lining could be the reason for the moistness and for the fungal infection. So even if you have to use it sparingly as and when needed. See that you change when you feel that moist feeling. And another thing is you could go in for the organic ones which do not have plastic, only and as when needed, because see that the area is having enough of you wear clothes which are breathable, which is cotton, the undergarments that I am talking about, so that you do not suffer from infections like the fungal infections, which is very common. Many a times also, Dr. Lili, as you said, I find that the reasons why the girls are using panty liners could be at times the very reason why they need to take medical help or seek permission, because they could be the very reasons which are to be dealt with. They may be suffering from excessive white discharge and they are using panty liners to prevent it, or to just avoid doing anything about it, but actually the cause is that they are suffering from a disease and they have been just temporarily tackling it with panty liners and worsening it actually in the long run. Isn't it, Dr. Lili?
As always, go to the root cause.
Yes. Yes. So now going ahead, we spoke about the panty liners, talking about what is best to be used during menstruation. Is it sanitary pads? Is it menstrual cup? Is it tampons? What do you prefer? What do you suggest?
I think the best would be a menstrual cup.
Okay.
It's the most hygienic, really, even though it's a bit icky to have to stick your finger in. And in virgin girl, it might be an issue, but otherwise it is the most hygienic form. It is the safest form because you're not going to get any leakage or spotting with it. And it does not involve the use of plastics with it because this is silicone and that is safe.
Right. So now with the advent of menstrual cup, and that being the safest and the best option, as Dr. Lili says. But if you have not been used to, you may find it a little difficult in the first go, but as you go ahead with it, you yourself will realize the ease and the hygiene that is related to the menstrual cup about it. But those who are so used to using sanitary pads, maybe Dr. Lili, we could tell them about
Or
the organic ones which are available, which are made from, I think, bamboo, from banana fiber and corn, and they do not have a plastic coating, or they do not cause, they don't have the tendency to cause infections, or they do not hold moisture within as such, and they are more easy. So could that be an option, Dr. Lili, if in case of, instead of menstrual cup, they are using sanitary pads?
yes, it's better than using the inorganic, the chemical ones, but then there
Right,
is physical discomfort of having it something between your legs. So
right.
it's easier really to be using
The menstrual cup, as you said.
which rarely lead to toxic shock syndrome, and therefore menstrual cup really is the safest option to use.
Okay, great. So that was about panty liners and about the use of sanitary pads or the menstrual cup, where preference is first for the menstrual cup by our leading gynecologist. So let's go to the next question, Dr. Lili. What is the relationship between hormones and weight, or hormones and metabolism? Part of it somewhere you have already replied to us in the previous questions, but we know a little more about the relationship between hormones and weight, hormones and metabolism.
So hormones are intricately related to our weight and to our metabolism. In fact, directly or indirectly, in both ways, estrogen is an obesogenic hormone. It causes obesity,
Okay,
it causes growth, and
right,
so is insulin. Now, when we are exposed to, say, junk food, disturbance, and nutritional imbalance plus toxins, and when there is stress, you have high sugar, and then you have high cortisol, which is then going to lead to high insulin, and
right,
insulin is also obesogenic. So estrogen and insulin, these are obesogenic. They cause obesity. So it's very simple to remember. Estrogen, insulin, obesogenic. So
correct,
the opposite, progesterone will help in weight loss. It will assist in weight loss. It doesn't cause weight loss. It will assist in weight loss.
correct,
So during the first half of the cycle, when there is growth, you feel that estrogen, uh, the weight gain. But then, um, if there is toxicity, if, for example, there is constipation, you don't have a proper estrogen metabolism, you will find that there is more chance of having, say, fibroid, of having polyps, or of becoming overweight. These are all
right.
kind of estrogen states. Having CA breast, all of them are high estrogen states.
Right. So ultimately, again, you come to lifestyle, right? So that is what is at the base of everything, at the base of hormones and the base of metabolism. So in short, lifestyle has no end. There is no finish line, and that is what keeps us going. And remember,
You can actually balance your hormones by balancing your lifestyle.
yes, so true, so true. So viewers, um, exercising and keeping healthy weight not only makes changes in our body, but also helps to change our mind, change our mood, our attitude, all for the good. So let's
Absolutely.
elevate our good hormones and bring about health and a healthy body weight, as Dr. Lili has been telling us throughout the session about how things have been going wrong because of a bad lifestyle. So let's make those changes that are necessary before it is late and we are not able to do anything, right? Okay, so going ahead, Dr. Lili, what is safe sex? What would you guide our viewers on this?
Safe sex is using protection.
Right,
So protection is not only to avoid HIV, it is also to avoid other sexually transmitted diseases. Not only just to avoid pregnancy, but to avoid especially sexually transmitted diseases. And if as a woman you feel that it is your partner is not inclined to use a condom, there is something called a female condom that you can use to keep yourself safe. But be sure to be protected.
Right. So as we spoke about safe sex, what is safe period
Okay.
when during the
Safe
menstrual cycle?
when we
Yes.
calculate the time when the ovulation is likely to occur. And the more regular the period, the more likely it is to be accurate, the time when we are calculating. But this is a very inaccurate way of contraception. Please rely on more reliable methods of contraception.
True. Right. Well, so so first of all, about safe sex, as Dr. Lili said, that there are so many STDs. I think more than 20 STDs which are there that are known and that can cause real havoc to the health. So why not take care, or why not be safe and prevent oneself from these problems by use of what is called as condoms, even the female condoms that are there if the male is not wanting to use it. So, Dr. Lili, as far as the safe period goes, you said that in spite of having said about the safe period, but one must not completely rely on it because the menstrual cycle may not be regular, and or it was regular, but when you think that could be a safe period and the next cycle turns out to be irregular, and you could be really in problem. Whereas, okay, viewers, Dr. Lili, correct me if I'm wrong, in a regular cycle, say of 26 to 32 days, day 1 to day 7 is what actually is the infertile days, and 12 to 14 days before the next period is what is the most fertile days, right? So having said this, but in short, as Dr. Lili said, that don't consider any day safe, go in for better safety methods, or else you could be in problem. Right, Dr. Lili?
Seen a patient get pregnant after having sex on day 5 of the cycle.
Right, which was least expected, and it happened.
This be a warning.
Yes, yes, very true. Okay, Dr. Lili, some females complain of painful sex. So what is the reason for this to happen?
I think the most important reason is a condition called vaginismus, fear of sex. That is being
Right,
driven into us in our society, that sex is bad, sex is painful, sex is something to be avoided. We taken the pleasure out of sex completely. There could be also physical reasons, such as a scar after childbirth, after episiotomy especially, or
right,
uh, or actually a physical scarring within the vagina, or congenital malformation within the vagina. So it needs examination by a gynecologist. But most
right,
often, with the conditions like vaginismus, it would need management by a psychologist.
right. Okay. So you have enumerated the different reasons very well, and I think even lubrication is what is could be one of the reasons where if there's not enough lubrication, that sex could be painful, right, Dr. Lili?
Especially.
Okay. Okay. So, well, viewers, why shy away from this topic on sex? Our very existence on this planet is
Absolutely.
connected with it. 7.8 or 8 billion people have not come from nowhere. So, we should be open talking about it, especially when it is a problem and when you have to seek to your doctor, when you have to speak to your doctor and seek medical advice, isn't it? Okay. So, going ahead, Dr. Lili, what are the things that a female should do or should know before she conceives or plans a pregnancy, or decides to plan a family? What are the things that she first needs to know, understand, and do?
Um, she needs to be nutritionally replete, in a state of best possible nutrition, optimal nutrition, because she is the only source for the nutrition for the baby. So she needs to be replete with calcium, with iron, with omega-3, with folic acid. So maybe about 3 months before the pregnancy, she could start taking care of her diet, her social support, her mental state. She needs to be calm. She needs to be in a state of joy and anticipation. She could check her blood group RH, whether if she's negative, check her husband's blood group also. There's no problem. If she's negative, we can manage whatever it is, but at least we need to be aware of where she's at.
Right. So the important things that you have told about the needs that are needed, that a female needs to check on about herself before pregnancy, and maybe we could add upon the thyroid hormone, the anemia, the
Yes, ma'am.
hemoglobin. As you said about the supplements, already you spoke about it just now, that are very important for her health. So females, it's very important that your health is in good condition before you conceive or before you plan a pregnancy, because that will be helpful to you and to your baby too. It will help you to be in the best of spirits, to enjoy your pregnancy completely. And this checkup with your doctor could help you to diagnose if there are any medical conditions which need to be treated before you are pregnant, or if there is any sugar which is high, so that too can be taken care of. Thyroid can be taken care of. Anemia, if it's so, then as Dr. Lili said, with nutrition, this can be taken care of, and with supplements as she suggested. And that will make you enjoy your pregnancy and give rise to a healthy baby and a healthy mother. Good. Okay, so going ahead, if there is discharge from the nipples which are not related to post-delivery or lactation period, it may be in young girls, unmarried girls, or otherwise. So any discharge from the nipples, which may be blood-stained or it may be milk-like, is that normal or that needs attention?
Absolutely, it needs attention, especially if it is bloodstained. It needs immediate attention. It could be something called a prolactinoma in the brain. If the then we will do a test called the prolactin test, and if it is high, then that needs to be further investigated and it needs to be treated. And if it is bloodstained, then we need to check the breast for maybe a
Right.
malignancy.
Yes, to rule out the conditions related to it, which could be as severe as a cancer. Since we spoke about nipples, anything that you can suggest related to pre-pregnancy corrections and care related to nipples, Dr. Lili? I think it's a very important aspect, which is important if they have to lactate, if they have to breastfeed their child.
So when they go for their pre-pregnancy checkup, the gynecologist will do a nipple checkup as well. And there is a condition called inverted nipples, where the nipple is pushed inside. Actually, it's not protruding out as it normally should be. And then, so that they will advise, and your doctor will advise certain massage techniques to pull it out. And if it is too bad, if the massage doesn't work, then it may need a simple stitch around to pull it out. So all this needs to be done well in advance of the childbirth. So ready, because of course you need to feed the baby.
Right. And we all know breastfeeding is so important, so vital for the baby and for the mother. Yes. So we need to take care on those aspects, as Dr. Lili says. So going ahead, Dr. Lili, urinary incontinence is one of the common complaints that many females, especially around menopause, complain of. So why is this so, and how can it be prevented, or what can be done about it?
So most often this has happened because of childbirth.
Right.
Damage to the pelvic floor, to the muscles around in the pelvis. And at the time of menopause, because of general laxity, because of the poor muscle tone, this is aggravated. And that is when and also the hormonal support is low, because of the low levels of the estrogen and the progesterone. So all of these contribute to laxity, and which will show up as urinary incontinence. And I've seen people say, oh, no, this much is okay, during sneezing, if you have a little bit of incontinence, it's all right. No, it's not all right. It's not all right. It does need to be investigated. It needs to be treated. It can be treated. It can be fairly easily treated. It's not a big deal at all, but it needs to be corrected. it leads to a loss of self-confidence to have leakage. So why should a woman undergo it at all when it can be
Right.
treated? And it can be sometimes treated very simply just by exercises, pelvic floor exercises called Kegels exercises. It may not even need surgery. But even if it needs surgery, it's okay. It's not a big deal. It can be done. It's not that big a thing.
Right. So, well, urinary incontinence, as we were talking of, was about dribbling of urine, a little spurt of urine that comes because of coughing,
Sneezing or coughing.
laughing, sneezing, yes. And so one needs to or can take care of this or prevent this by having your pelvic floor, your muscles healthy by doing the exercises that Dr. Lili just spoke about. They are called Kegel exercises, and you will get to know about this as to how to do. You can surf, you can meet your gynac, you should seek medical advice and get going so that you can laugh to your heart's content when you meet your friends or otherwise also, and you are not restricted from anything. So, well, going ahead, Dr. Lili, we are coming almost to the end of our session. Pap test is something which is very important. So should one, when should the female start with this pap test, and how often should she repeat it?
But this is going to tell us about the cervical health, the health of this mouth of the uterus that's called the cervix. And this she should start doing the test once she becomes sexually active, whatever age that might be. It could be in the teens or it could be in the late 20s or 30s, whatever it is. Once she becomes sexually active is when she needs to start. Ideally, it's about a year. Every year it needs to be done. But I guess even if you do it every alternate year, I would still accept it as quite okay.
Right. Is it needed more frequently around menopause or after menopause? Is it yearly that you would recommend, or
Well, maybe just before menopause, but after menopause, if there is no discharge, there's no warning signs of, say, a bloody discharge or something, then I would
right?
not really be concerned
Okay.
too.
Okay, right. So, as we were talking about menopause just now, so what is the signs, or how would a lady come to know that she is menopausal?
So we define menopause as 1 year of no periods.
Okay,
But usually, by 6 months, 8 months, you know that you're going into menopause. You are the right age. You don't have periods. You may or may not have menopausal symptoms such as irritability, depression, or mood swings. These need not happen for every woman, but
right,
just not having periods. And then, of course, we confirm it by doing a test called the FSH, the follicle stimulating hormone. We check that. It's a blood
right.
test. And if it is above 40, we know for sure it is menopause. And sometimes menopause can be early, premature menopause. Even in a 38-year-old, if we find that the FSH is 40, then we have to treat that because that is premature menopause.
Okay. That's really important, something that you have guided us so well, viewers. Don't let age change you. Change the way you age and change the way you get menopausal, being in a good state of mind, being healthy, and having a healthy lifestyle. So, as we come to the end of this session, Dr. Lili, I would really thank you for your presence today, for all the guidance, the knowledge that you have shared with our viewers. I really am very grateful for you joining us today on our session. 1 minute, Dr. Lili.
Thank you so much. And thank you for putting all that went.
No, that technical problems do happen, and we have faced that in the past also. So it was really nice having you on our session, Dr. Lili. Well, viewers, I would like to say to you something before we end this session, that many a times the female problems usually arise because of denial of self. Uh, Let me tell you, it's very important how we think and feel about ourselves. When a woman takes care of her health, it doesn't mean I first or me first. It says me also. So let us put ourselves high on the priority to-do list, just as we put our family on our priority list. So we should be grateful for being a woman, be healthy, be yourself, take care of yourself, be happy, and you will take better care of your family. That is what I would want to say to our viewers before we end this session. And once again, thank you so much, Dr. Lili, for being with us, for joining us today on our session. It was really a pleasure. So viewers, don't forget to share this video with your friends. It would help them better to take care of their gynec health, of their female health, and it will also prevent them from shying or not being able to communicate about their problems, gynec problems. So do not forget to like, follow, and subscribe to our social media handles, be it Facebook, Insta, or YouTube, and spread the knowledge that Dr. Lili just gave us during our sessions. Thank you so much, viewers. Thank you, Dr. Lili.
Thank you. Thank you so much, Dr. Acharya. Thank you.
Thank you. Thank you.
Beautiful.
Thank you, Dr. Lili. And viewers will be back again next Friday, same time, same day. Thank you so much. Bye-bye. Thank you, Dr. Lili, once again.